Good afternoon and welcome to GP Podcast by Nadia. Today is Wednesday and Wednesdays are usually my days off. So I'm making this video in the afternoon. It's around 1:15 p.m. now. So yesterday we were talking about obesity and its available medications or treatment in the market. And I told you that there are two groups of medications in this case. One is the oral medications that are approved for private use for weight loss, and then there are injectables. There are 3 to 4 kinds of injections which are available in the market. The one that I am going to talk about today, which is my favorite as well, is called semaglutide. What is semaglutide? Semaglutide is one of the GLP-1 receptor agonist. What is GLP-1 receptor agonist? In easy terms, it is one of the classes of anti-diabetic medications. So diabetes, when we manage type 2 diabetes, there are 4 to 5 groups of medications that we choose the medicines from to treat a patient. This is one of the bigger classes. This is one of the major groups, which is called GLP-1 receptor agonist. And semaglutide is a medication of that particular class. This particular class has got several cardiovascular and renal protective benefits. So this is a very good group, and semaglutide is a medication that is injectable. So it's a once weekly injectable medication. It's subcutaneously injected, like just under the skin, and it's very easy to administer. You just choose a day. For example, you choose Monday or Sunday or Saturday, and every week you should just make sure that you do it on the same day and on the sites recommended around the abdomen and other areas, and you have to alternate the areas to do it. It's very easy to do. Many YouTube tutorial videos are present to teach you. What I do is, if my patients usually are hesitant in the beginning, I do the first injection for them to show them, and they are just happy after that to do it themselves. It's very, very easy to do, no pain at all, and so it's very easy to administer. So you do it once weekly, and it remains in the body for a week. What it does. So basically, it is in Australia, the brand that is approved for diabetes mellitus, type 2 diabetes mellitus treatment is called Ozempic. What it does is, it stimulates insulin secretion and decreases glucagon secretion. In this manner, glucagon and insulin are two hormones that regulate body's sugar levels. So insulin is good and glucagon is bad, so it increases insulin and decreases glucagon, and this is how it regulates the blood sugar levels. So decreases the blood sugar levels and regulates it. So this is how it works for diabetes. Now, how does it work for weight loss? It works for weight loss by delaying gastric emptying and increasing satiety. So what happens is, so for example, if you were a person who was eating a full pizza at one time, when you are on Ozempic, you'll just maybe eat one slice of pizza and you'll be like, oh, I'm full. I don't want to eat anymore. And then you are full for long periods of time. So what happens is, it decreases the, your stomach, and it decreases the time from through which the food is transferred from stomach to intestines. Like, it takes a much longer time. And then that gives the signal to the brain that we are full. So previously, the food that was rapidly going through the stomach to the intestines, and you could eat whatever you could eat. Now brain gets the signal that now we are full, I can't eat anymore. So this is how it works for weight loss. So it says that 2 to 6 kgs over 12 months is the weight loss that you should expect, but that's actually, it is written what it is, but people actually shed their weight rapidly as well, much more rapidly. I said yesterday in my video that you can be on it for lifelong. Yes, for type 2 diabetics, you can be on it for lifelong. For weight loss, you do not need to be on it for that long, because you usually achieve your results within 1 to 2 years, even maybe lesser than that. But for example, if you go off them and then after a while you think, even by doing exercise and diet, you are not able to keep your weight down, so you can always go back on it. So because it has got least side effect profile. What are the side effects? The commonest side effects are nausea, vomiting, egg burping, diarrhea. Because they work on the GIT, the gastrointestinal system, so they can cause a bit of gastrointestinal discomfort. You may be nauseous, you may vomit. People have always spoken about a very bad sulfur, egg burping kind of stuff, and diarrhea. They usually subside after a few weeks, so you don't have to worry too much. But what I do with my patients is, when I start them on Ozempic is for type 2 diabetics, and then Wegovy is the brand, which is the private brand present for weight loss. So what I do with them is I put them on regular anti-nausea medications for the first 2 days, like the day you start and the second day. So ondansetron wafers 3 times a day for 2 days, or Mexolon 3 times a day for 2 days. This actually reduces occurrence of, actually it might not even let you make, like it's a precautionary step, so you wouldn't even be nauseous. And I will also start them on some Nexium, which is a PPI, which is for anti-reflux medication. That also can save you from all these side effects. I mean, Nexium could be regular. Some people are usually on Nexium anyways. And Nexium can be like just for maybe those 2 to 3 days, the first 2 to 3 days. So you can take precautionary steps even to avoid these side effects to happen. But if these side effects happen, they usually subside after a few weeks. Again, my video is again exceeding the time limit, so I will continue tomorrow. Happy Wednesday.